I met Michael on a picket line in 1980. He's the president of the Ontario Council of Hospital Unions for QP. Mike Hurley. Thanks.
Thanks very much, Stuart, and thank you so much for coming today. When the documents were leaked out of the Ministry of Health in January at the ADM level, they said that there were a number of services that were going to be privatized under this new legislation. They included, as Joanna said, nursing home inspections, laboratories, air ambulance services, back office services, and procurement, among others. And the Conservatives have denied that. They've said that no one should worry about privatization because you will still be able to use your health insurance to purchase medically necessary services. Although medically necessary services, as you know, are under negotiation at the moment between the doctors and the government, and there's an attempt to reduce services, like eliminate them from being covered by health insurance, services like colonoscopies, which are, it's a huge development. In this bill, I mean, no one has ever, to my knowledge, called for a massive restructuring of Ontario's healthcare system.
Shame.
Nobody has ever asked for a parallel Ministry of Health to be created and the transfer of almost all of its programs there. Nobody has ever said that Cancer Care Ontario, which leads the world in terms of cancer care, sets a great example here. Ontario was in need of merger with other services. Nobody ever said that the most efficient hospital system in the Western world, in terms of lengths of stay, in terms of dealing with a vast number of patients with the fewest number of beds and staff, was in need of a massive restructuring. What people have said is that these services are in need of an infusion of resources because Ontario underfunds its health care system, including long-term care, including home care, including hospitals, at the lowest level of any of the provinces in the country. That has always been the most significant issue facing Ontario healthcare, the lack of resources, and that is the reason why we have access issues in Ontario.
Shame.
And perhaps naively we thought when the Conservatives promised that they would end hallway medicine that they meant to address the resource problem. But no, it appears that what they really intended was to create a market for healthcare services, to commodify and sell clinical and support services across the healthcare system. And you have to hand it to the Progressive Conservatives. These are grand thinkers. They think on a major scale. And so they are thinking about privatizing clinical services. This is what they've told us as a union, CUPE, when we talk to them about what we can expect in the restructuring ahead. And I tell you this because I want you to hear in what they're telling us what they are thinking in terms of clinical services. They say that they want to change labor laws so that they can move clinical services without having to take the workers. And they use the example of the Ottawa Fertility Clinic. And they say in that case, the Ottawa hospital divested itself of fertility services and moved it to a freestanding clinic which was owned and operated by doctors. And the nurses went and they were taking a pay cut, but their union insisted on their collective agreement following them. And the government wants to change that. Now, what's interesting about that is, why are they so fascinated by the transfer of work around clinical services? Why does that captivate their imaginations? Because they are planning to divest quite a number of services which are currently embedded in the healthcare system in the not-for-profit section and privatize them to doctors and others who will operate these services.
Shame.
And we know what happens in these types of events, and I'll just give you two examples. The Canadian Medical Association Journal compared the death rates in privately owned and operated dialysis clinics and publicly owned and operated dialysis clinics. The death rates were higher in the for-profits and the life expectancy was shorter. And why was that? That was because the owners of the clinics watered down their blood cleaning products to maximize profit.
Shame.
I wish I were making that up.
Shame.
Canadian Medical Association Journal, a comparative study. And I'll give you another example in the support services. SteriPro, the sterilization of surgical instrument, and to its shame, the hospital in Pembroke, Ontario has contracted its sterilization to SteriPro, owned by a doctor, and they've set up a mega warehouse there. And you should know that the Trillium Hospital had to cancel its contract with SteriPro because so many of the instruments were coming back with blood and bone fragments baked onto them that the surgeries were being canceled and the physicians couldn't take the loss of income. This is what this government is planning, is to move services like colonoscopies, move services like fertility, move services like sterilization out into the private sector where people can take profit from them. And I have to say on behalf of some of the people who work in the hospital and the healthcare system in Ontario that we are not going to allow these services to be degraded, and that we know that the public stands with us in that. And I'm so proud of the Ontario Health Coalition for the fight that it's leading. These town hall meetings are happening all across Ontario, and the numbers of people attending them are bigger and bigger, and you have to know that the only reason there were legislative hearings is because people like you contacted their MPPs and insisted that there should be some committee hearings. This government has the capability to pass this law. It has the capability to set up Ontario Health. But as a previous Conservative government attempted, overreached in terms of privatization, the last Conservative government, for example, wanted to privatize ambulance services. They brought up Rural Metro and other for-profit providers to Ontario, and they were determined that they were going to privatize all of the air ambulance and all of the land ambulance services, and we fought them, all of us fought them over years, and not a single service was privatized, even though they wanted it, even though they had the capability to do it. Just like cancer care, they wanted to privatize it, it never got privatized, and we're going to stop them now. You have to believe that we have the power. And so on April 30th, when we have this rally, on April 23rd, when we have a sticker day, and all the people who work in healthcare, in the community health centers, in the hospitals, in long-term care, are going to support the Health Coalition by taking a stand against privatization. And all of us who are going to get on the buses, we have to believe that even though they have a majority, we have a majority of the public with us, and we are going to win if only we determine and mobilize ourselves, which we can do because we've shown we can do it in the past. So thank you so much for coming today.
Thank you, Mike.